And now we welcome Mr. Ayesh, CEO, Mr. Omar Ayesh, CEO of EHS Hakeem.
Thank you very much. وين التيم؟ Thank you very much, Dr. Iyad, for giving us an idea about the technologies that are used in healthcare. I will talk about what we are doing in Jordan, where we are in Jordan, and what do we need to do in Jordan to reach where others have reached before us, and utilizing our resources. It's limited resources, but luckily we have done a lot in the past 15 years. Healthcare technology is transforming the future of healthcare. Medicine, it is enhancing the way medicine is been delivered. It improves outcomes. It enables more personalized access of care. This has been done through different technologies that are used. In Jordan, we started with our digital transformation program in healthcare back in 2009. And we were maybe the first country in the region that looked at a countrywide solution to improve healthcare in Jordan. Post-COVID or during COVID, we found out that there are technologies that can be utilized, for instance, telemedicine. The first telemedicine program in Jordan that I was a part of was in 1995, when we connected King Hussein Medical Center with Mayo Clinic at that time, upon the directions of the late His Majesty King Hussein. But it wasn't utilized as much as it can be, especially these days. These days, it is acceptable that doctors can consult other doctors remotely using technologies, and that the cheap technologies now, at that time, the project cost millions of US dollars. Today, with limited few $1,000s, you can easily set up a telemedicine practice between organizations, now, especially between remote areas and central areas. In Jordan today, most of MOH and RMS hospitals, which they care for around 70% of the population in Jordan. 318 sites. The number is 15. That's when we prepared the slides 2 weeks ago. Now the number is 318. Now 318 healthcare facilities all over Jordan is fully digitally transformed through the Hakeem program that was launched in 2009 in Jordan. This is the first national digital health program. It's a unified system. Many countries worldwide figured out that they need a unified system after COVID. When the COVID erupted in 2020, lots of negatives came out to surface, and especially when it comes to healthcare delivery, and many people, or many countries, they found out that there is a lot that can be done to help communities through utilizing technologies. The Hakeem program is a centralized EHR system. We started as EHR system. Today, patients, wherever they go, among MOH and RMS, their medical records is accessible from either organizations. We have implemented the exchange recently, 2 months ago, and their medical records is accessible. So this will improve and will help improve the healthcare outcomes. Uh, Definitely, the Hakeem program has helped in improving patient care and empowering both patients and healthcare providers. It's a real-time information sharing, and better data-driven decision-making is been taken in Jordan. If we look at during COVID, every 3 p.m. During COVID, we used to provide the government with a report on the status of COVID patients among the Jordanian hospitals. So the decision or the government studied that reports, and they came out with decisions to see what can be done depending on the data that was provided to them. Empowering patients came through the first portal, patient portal, My Hakeem. My Hakeem today is accessible for 70% of the patients in Jordan who are being treated at Royal Medical Services and at MOH. Patients can access their medical record. They can access many of their health information. They can request their medication. Today, MOH and RMS patients can request their medication to be delivered at home. This service is only available at MOH and RMS today. And through that application, and they can book their appointments through this patient portal. At the same time, the e-health evolution has helped in getting access to patient information from all over Jordan, enhancing accessibility for both patients and doctors. وبعدين we connected the My Hakeem program with e-payment gateways because some patients need to pay some premiums. They need to pay some patient share. So it is done through digital e-payment gateways available in Jordan. At the same time, we have introduced Doctor at Hakeem for MOH and RMS, where doctors can get access to their patient's medical record whenever they are and wherever they are. AI. People will say, Hakeem, you have tons of data. We have around 1 billion X-rays among our system. We have tons of data. Why not starting AI? We have started a little bit. We are planning on to move forward with different AI projects at the moment. Definitely, AI can be helpful, as Dr. Iyad just mentioned and talked about. It can be helpful for decision maker. It can be helpful for diagnosis. It can be helpful for predicting many diseases and many outcomes that can happen. Health data analytics that we have launched in 2019 was a program utilizing the data that we have, mainly to help 3 types of people: decision makers, researchers, and providers, to take a real-time evidence-based decisions. This is done through our Huda Health Data Analytics program that has been implemented for the past 5 years. Several projects, several researches that we have participated in, like the treatment plan, one of the researchers, treatment plan, prediction using AI for chronic diseases. We started with diabetic patients. That's one example of the researches that we have started recently. One of the projects is several registries. We're talking about national registries for chronic disease patients. We have a registry for dead people. We have a registry for cardiac surgeries that has been done at Queen Ali Heart Institute, at King Hussein Medical Center. we have workload analysis project for MOH and RMS, and we have done an AI project at MOH bed management system. Because if you remember, early in 2022, a 10 years old child, has been taken to Al-Bashir Hospital, but they could not find a bed for her. And she died during transfer because of the delay in transferring that patient. So we worked with MOH on patient bed management system to help people, doctors and to help emergency departments identify the nearest bed available at MOH facilities. And we are looking forward with MOH to expand that to cover all hospitals in Jordan. Our latest product is Jordan Health Registries platform, a single platform that will access 50 registries in the coming few months. This is a unified platform, accessible Jordan countrywide for all facilities, whether it's MOH, RMS, private. They can access, people who are allowed to access, they can access these registries and get the information that is needed to help them perform their decisions and taking their decisions. At the same time, we are preparing to launch our first AI project with X-rays. X-rays interpretation for chest X-rays. As Dr. Iyad has mentioned, from chest X-ray, you can read a lot. More than 30 parameters will be detected through AI. This project, we are preparing for this at the moment, and it will be launched very soon. At the same time, personalized care is the future of healthcare. We are working today with Queen Alia Heart Institute on a genome project. This genome project will help identifying the best medication and the best dosages for patients on a personalized level by the sequencing of genomes for cardiac patients. This project will be kicked off very soon as well. We started the preparations for that. Our vision. When we started Hakeem, it was His Majesty's vision to have a single record for each and every resident in Jordan, wherever and whenever they go to any healthcare facilities. So, but during the implementation, we were forced by different challenges that stopped us from doing that. So when we started the project today, we have a single record at MOH, we have a single record at RMS, we have a single record at the Cancer Center, King Hussein Cancer Center. But today, or starting 2 months ago, when we implemented our data exchange platform, now patients at MOH and RMS, their records are accessible through both organizations. And this will help expedite and improve the treatment plan and the treatment for those patients. The future is connecting the private sector, university hospitals with on one single digital data exchange for everyone to be accessible through all organizations. I think I'm done. Thank you very much.